old saying, we ain't got time for that. I'm just going to go ahead and answer the burning question that's on your mind. Why did the chicken cross the road? Wait for it. Because that's the SCHIex way. Right. Come on. It's original. It's not okay. The goal. Now how many of you know Farsad Mostashar? Anybody's been in his presence, know him? He's the big guy, or used to be. He resigned, did he not? Yes. He's a big guy in Washington with the ONC, but this is his statement as it relates to the health information exchange. The goal here is that information follows the patient regardless of organizational, geographic, or vendor boundaries. Very profound guy if you've ever been in his presence. These are the fingers. Think about what makes this health information exchange easy. Your PCP and specialist, your CCC, your hospital systems, rehab, all the way around the circle. See all the fingers that it touches if you think about a very connected, secure network. This is what we're looking at with SCHIex. This is the scope, the dynamics of it all. And then our organizations, providers, hospitals, CHCs, medical offices, state agencies like Medicaid, public health. And then you have your interstate, then you have your other states, and you have the nice little hospital network system. All of it, if you have a hospital network, can still connect as one entity to SCHIex. See, and then you're all on, and it's all good. Questions on that? And so today, what we've already talked about, we're going to show you Exchange. We're going to show you how that works. We're going to show you about Clinical Viewer and how it's integrated with Direct. We're going to give you a presentation on that. Okay, so what is Exchange? This is just the skinny, robust, fully automated, bi-directional. Think about that and just let that resonate with you. Robust, fully automated, bi-directional. Health information exchange, sometimes referred to as query and retrieve. You're going to hear me say, we're going to query it now, we're going to pull it now. That's kind of the terms that we use with SCHIex. The gateway enables bidirectional exchange with the state immunization registry, and we all kind of had a comment when David mentioned that. That is important. With the state immunization registry, your clinician and ancillary staff are going to love you. I'm telling you, they're going to love you because it is bidirectional, it is quick, and you're going to see the example of what that looks like. How many of you have to log in or understand how to log into the CARES portal today and have to type all that information in and do it twice? Okay, gone. Those days are gone. Just get boarded with SCHIex and you don't have to worry about that anymore. Okay, eHealth Exchange, formerly Nationwide Health Information Network, Connect Gateway, enables veteran health data exchange. So we're going to see that in our example today. So this is how it works. Here's a medical summary document, a CCD from a hospital system right here. It shows the little links that you can click on that get you to the different areas. It's a bona fide, certified CCD. You're going to see that document created in the example. Here is the immunization registry document that you'll see when we query it from SCHIex, and the immunizations down here, the history of that patient. So that's what that looks like. Most of us are familiar with a CCD. Okay, and so now, the provide patient identifiers to SCHIex over. That's step one. Step two, the provision of medical summary documents that will be available for exchange to participate cross-enterprise document sharing. We call that XDS. That's the process of the document. And then it sends its metadata over to SCHIex so that it can find all of the little information that we can index out and retrieve the patient's name and make sure that we've got the right patient to send back to you, the query and pull process. Those are those two steps. Step three, we query and retrieve the documents from the other participants. So we have Dr. Smith here, who is the PCP. You got SCHIex in the middle. And then you have Dr. John Doe, who is an ENT. He's the specialist. And we're going to do a referral. So the patient CCD is registered into SCHIex. Then it goes over to John Doe. John Doe sends a request in as well on his side. And then it goes back to Dr. Smith. And you see he's able to pull those 3 documents now that have been created among that little network. And then he sends that back, okay? And then now Dr. John Doe gets 4 documents that's been created since the time that the patient encounter started, originally with the PCP. Any questions so far? How we doing? Okay, y'all ready? This is exciting stuff. Exciting. Okay. First scenario, we have a 15-month-old female patient. She's at the PCP office per emergency department discharge instructions. So the patient had to go to the emergency room, and they got discharged to follow up with the PCP. Patient was seen a few weeks ago for fever and cough. The mother reports medication prescribed. The emergency department, but forgot the name of the meds. That never happens, right? Child developed generalized rash in the last 2 days of medication. Immunization status needs to be assessed. So the PCP reviews the medical summary information via SCHIex. The ED summary shows the CCD for the visit, what took place. It shows the diagnosis of otitis media, and they assess this for the 4th recurrence in the past 12 months. It's a really comprehensive scenario, a real-world kind of deal, okay? And then we look at the immunization registry, confirm the patient is due for immunization, and we administer that. And then the PCP registers the encounter medical summary with SCHIex. So that's the video we're going to see. Now, we are going to show you the video of the steps. The user is following the steps, and we can visualize with those steps, and that can be a provider or a clinician who is actually performing the duties. You know, we have multiple staff that starts at the front, works their way back to the doctor, but we're going to show you all of that in one step with one user. And we're removing the audio of the speaker who was performing the steps so that I can just interject what's happening based on this scenario. Okay, so we concatenated all that together in a short, brief video, about 3 or 4 minutes in each of the scenarios. All right? Now, how many of you use eClinicalWorks? Okay, so you'll be familiar with this video. In the second scenario, SCHIex. SCHIex. Okay, good. Well, then you won't be familiar. So we'll discover that together, all right? Let's see. Okay, this is eClinicalWorks. This is the patient scheduled here for the visit. Y'all familiar with this piece? And he's going to click on the patient that's scheduled, click Edit, and then he's going to start the encounter. Now this is the patient presenting as the follow-up from the emergency department. Okay, and so then we bring up the appointment information. We immediately go into the demographic portion, and it shows us everything about, and we come down and click Patient External Documents. There's a little link at the bottom of eClinicalWorks there. There's your documents. There's the Roper St. Francis CCD that was created in the emergency department. The user's going to bring up the CCD so that they can assess and see what was done. Now, we've already pulled just that fast from SCHIex. That's how it happens. Okay? They're going to go through the different areas of the CCD. Now we're going to go to the next one, which is the immunization registry. Just that fast. And you see the history of the patient's immunizations. Okay? Good. They're verifying that. The provider's making an assessment to make sure that they, if I walk around a little bit. Thank you, Lathan, for saying I don't have a big mouth. Appreciate that. Good. Oh, that makes me sound good. Wow. Okay, on to the video. I'm sorry, Adrian. A little sidebar there. Okay, we're going to create the progress note now. So we start with the chief complaint, right? We've got to have one of those. Verify that information, and then You know, basically, what we're doing now is going through the steps that it's going to take to create the encounter. All right? Now we're down in the plan, immunization. We're going to order those immunizations that the provider feels was important at the time. Put that information in. This is the fastest encounter y'all have ever seen. Right? Wouldn't that be great? We could see 50 patients a day. What do you think? That'd be good. Okay. Then we're coming on down to the next appointment, follow-up appointment. Finishing up now. We're verifying everything, and now we're going to save the document. Document is saved and ready to go, and now I think what has to happen is we verify all of the information that's been created from the encounter today. Now we're going up to the top, and we're going to export. Okay? We clicked export, and that's done. And there's the CCD. And correct me if I'm wrong, not only has it been created, but it's been sent at this point. It's a done deal, and it's sitting in the repository. Now let me clarify that for you. The document hasn't been sent anywhere other than the repository that you identified as the place where you want to save the CCD. Okay, it's your CCD. Nobody else has it. Nobody else controls it. Nobody else is responsible for it but you. What happens with SCHIex is the little engine that could. So in the next scenario, we're going to see that scenario, talk about it, and then they are going to pull out of your repository the CCD based on the XDS document and the metadata that's out there. It's indexed, okay? So it's still with you at the PCP provider office. It hasn't left. It's your repository and it's your data, and it only gets pulled if a technically bona fide, certified, production certified entity is boarded to SCHIex, and they're allowed to use that patient's information. All of the consents have been done. All right, any questions? It's pretty cool, right? All right, let's go to scenario, still scenario 1, but the second visit. So they decided to send the patient to an ENT so that the ENT could insert tubes, okay? So now there's a third document available. Remember, you have ROPER, and now you have the PCP, and you have the immunization. So there's 3 documents out there in SCHIex. And the pediatric ENT is going to review that summary in this next scenario and incorporate the allergy to augmentin and perform the ear tube placement procedure. Specialist then registers the encounter, the medical summary document with SCHIex. And we're just waiting for it to load. Okay. Now this is SCHIex. All right, so the patient has presented. We're going to go up and look at the appointment, the chief complaint again. Click OK and confirm. Now the patient is tagged and ready to go. I'm going to click on the chart overview. There's the patient's chart, and over here is a little link with SCHIex called HIE documents. We click on the link, click on inbound documents, and there's 3. You see the 3 just like if you had 3 emails. And now they can review those 3 documents. So here's the first one from the emergency department. So the provider is going to go through, see all of the information that happened out of Roper, St. Francis Hospital, emergency department. Checking the medications that were given, the procedure, the immunization. Okay? Here's the 3 documents right here. So now we're going to the second document, looking at all the information from the PCP. Okay, we're verifying that. Okay, now we're going to the third document, which is the immunization registry. You see, just that fast, query and pull, and there it is. So the provider now has in their hands all of the information that they need, and nobody had to go and bring up the document, put it in the printer, send it out, put it in the fax machine, send it out. None of that. It's all green, it's all electronic, it's all secure, it's all fast. How about that? What a wonderful world. All right, so now we're going to do the encounter. Go through the steps here in SCHIex, SCHIex. Applying the allergies. I am surprised there's no one in the room that used SCHIex, SCHIex. You know why? Because they're all in Birmingham. This is the user group conference week. That's where everybody is. How about that? I could be in Birmingham. And I chose to be with you today. Okay, we're finishing up. Here's the diagnosis. In the order, process. Okay. Just some comments here that we're going to put in. Procedure completed successfully, saved, and a little button at the top, got to put vitals in. Vitals are important. We're kind of out of sync in the workflow, right? But we have to put those in order to get the encounter saved. So we're going to say that the patient is still alive, has a heartbeat, all that good stuff. So you can just picture and imagine in your EHR system how that process works and how cool it would be to have a little link. Just click on the link and there's all the information, patient history. Okay, we're done. Oh wait, we got to do the medication because the patient just had a tube put in, so they need some meds. Be in a little pain. Okay, so we're going to pick that one. RX is generated. Saved into the patient's chart. Okay, so there we have an overview right there. Description, vitals, we got meds, we got allergies. You see how it's red in here showing that it has the information that it needs. And they're going to go over here and save the, they're going to sign it off. Here we're saving and signing in one click. And I believe, if I'm not mistaken, when they perform this step, that's when it's saved and immediately puts it in their repository, again, that you own. And now that document is available. That metadata has sent its information to SCHIex. It's available and ready to go. Any questions on scenario 1, visit 2? All right. Now, we're following the patient as a follow-up. Had the tubes put in, they're going to follow up with the PCP again. So what are we going to get at the PCP? The provider's going to go in, they're going to look at that link and click on it, and guess what? They're going to have 4 documents out there now instead of the 3, right? So let's see how that works. So here we are with scenario 1, the third visit back to the PCP. And this is a very short video because it's just going to show you that we were able to bring up the document. And I'm just waiting for it to load. Okay, so there's the patient on the schedule, coming in for the follow-up. Click on edit. It's like I'm commanding them to do that right now. Click on it. Okay, there's the hub, which gives them the demographic information. And again, you'll see the little icons down here at the bottom. Click on patient external documents. Again, it'll be a little different for each EHR system, but this is what eClinicalWorks looks like. Patient documents will populate, and voila, there they are. And there's your Little River medical encounter summary, which was what they created the first time. There's Fairfield. Little River actually did the inserting of the tubes. Fairfield is the PCP. Roper was the emergency department. Okay, and then the immunization. So, provider is pulling up a CCD from Little River. By the way, Little River is technically boarded, production certified. They are on board with the immunization registry, and they're connected. So we're very proud of that as a little community health center in Little River, South Carolina. Okay, that's the third video. Now, we'll stop because we'll go into a different scenario, a different part of what SCHIex is going to show you. Do we have questions burning on your minds other than the chicken across the road? Go ahead.
So, concerning the NPI that SCHIex generates, how is SCHIex, if I have a patient who I've never sent a CCD on, yet they may have CCDs from other providers, how is that NPI associated to a patient in my EHR that I would think SCHIex doesn't know about yet?
Okay. So I'm going to let...
You have to submit once
Yes.
for that patient. Okay.
And step one included sending some identity feeds to SCHIex, we sent some demographic information as well as the ways that you have referred to that.
Did everyone hear the question?
Yes. Step one, if you remember the step 1, 2, 3, includes sending some patient identity feeds to SCHIex. Those are the first transactions that come. They're called HIX feed. But they, in essence, let SCHIex know that these are the patients associated with that location, and this is how they're identified. And then SCHIex matches those to that patient and how they're identified everywhere else, and kind of coalesces those domains into that any time that patient is queried with any of those pieces of data, it knows they're all the same patient. So that's a key part, and that's also the reason that if you're trying to query for a patient that's not registered in your EHR and sent that identity feed to SCHIex, you really won't be able to do the query. And on a kind of policy side, that's an extra protection because, you know, really only providers that have a relationship with the patient, that have had a registration event with their EHR, would have a need to query for information about that patient. One of the first tests that we'll do in the onboarding process.
Okay. Question right here.
My name is Emma, and I'm with an EMR vendor, and we have a lot of practices that, just as Sue had mentioned earlier, might be right on the border, right? So maybe I've got a patient who's in South Carolina today, but they were seen in Georgia yesterday. So this is the South Carolina Health Information Exchange. So my question is, how does SCHIex communicate with other states? And if SCHIex doesn't directly, or maybe they do, are they a part of a larger health information service provider? I know like SCHIex, for example, is a HISP, or health information service provider, that connects a lot of other state HIDs together so that they can communicate. So how does that all fit together?
Great question. And so I brought up the slide here, Adrian, to show that South Carolina Health Information Exchange is the federated model, and when other states follow that same model, then we can connect, or they can then technically connect to SCHIex if they are interested in exchanging across state lines.
Yes, and one of the key ways that we see that happening, or really two, is SCHIex is an anchor participant in eHealth Exchange, which was formerly the Nationwide Health Information Network. It's called Healthy Way. And eHealth Exchange is a way for various states, many of which are actively onboarding to eHealth Exchange, just like SCHIex did. It provides, ultimately, it provides connectivity for the query retrieve aspect of exchange across state lines, as well as with the federal health architecture that David mentioned. But more immediately, we have worked and we've executed agreements with 5 states now: Florida, North Carolina, Virginia, West Virginia, and Alabama, to do HISP to HISP, and I don't want to get into that too much, but where we can send direct, secure messaging back and forth. And Georgia is actually reviewing the agreement now. We've already done the technical testing, so even though query retrieve exchange is kind of the gold standard, direct is a great way to get started with those out-of-state providers, and that could happen, now, because those agreements have been fully executed, and we're working hard for Georgia. So those are kind of the tools we have today, and I think probably our primary vehicle for that to happen is through eHealth Exchange and Healthy Way.
And so there is no current direct connection with SCHIex?
For their direct service?
Yeah.
Not at this time. I've had a couple of calls with them and reviewed their agreement, so that's something we could pursue. HISP can agree to change with other HISP, and for everyone's benefit, a HISP is a health information service provider that manages the transport for the direct, secure point-to-point messaging and handles the security and transport, and we can make arrangements with to execute agreements and do testing. And with the eHealth Exchange, one of the things I wanted to point out, that's a gateway that just sits on SCHIex, and by joining SCHIex, you can leverage that gateway for the same core service. It's not an extra service or an add-on service. It just kind of comes with it, like the immunization registry exchange. So as this thing grows, as the months and the years come, it is a way that you'll be able to communicate, not just within the SCHIex community, but beyond. So.
Thanks, Adrian. Anybody else? Yes, sir.
Okay. Is SCHIex considered to be a third-party agency to where we'll need consents from the patients for their information to pass through the gateway to the systems? And then a subset is who would be liable if there is a breach in the patient information?
It's a good question.
Yes. The first part was
Third-party agency.
Third-party.
And will consent be required?
SCHIex is right now. It's governed by a governance committee appointed by executive order, an 11-member committee. So it is almost a quasi-state agency. Part of the charge of that interim governance committee was to establish a permanent governance committee for SCHIex, and that's well on the way. And as many states, SCHIex is looking for a not-for-profit organization who would assume that permanent governance and operate SCHIex for the benefit of providers and patients across the state and for the improvement of healthcare. So that would be the entity governing SCHIex. In terms of if a breach occurred, I think the liability would rest with where the breach occurred, as it would in any case now. SCHIex requires and also manages audit logs for every one of those transactions where a document moves from this participant to another participant. that activity is logged, and once it gets into the EHR is required to have logs, so it is possible, certainly, and expected a requirement to be able to trace where information flows and who has access, viewed, downloaded, or seen that information. So from that standpoint, it gives a lot more control in terms of any type of breach or incident and being able to determine what happened.
But then
I'm not
liability
sure I
would go down
understood
to
that.
the provider.
I'm not sure I understood that answer. Can they opt out or?
Oh, on the consent,
or do
yeah,
they
sorry.
consent?
SCHIex uses an opt-out model, and what that means is the policies require that each participant in SCHIex exchange provide their patients with notice about their participation in SCHIex. SCHIex is not just a set of technologies. Equally important, it is a policy and legal framework for trusted health information exchange, which is another thing that you can leverage by being a member of SCHIex. There is a standard, and I'm kind of getting in my presentation, so we can move through that a little quicker, but I think this is a really important question. The governance committee has made decisions about the model, such as the federated model, that based on provider input in South Carolina, that best meets the needs of patients and providers here. So the policies of SCHIex primarily mirror HIPAA, but they do require that each patient be given notice about that organization's participation in SCHIex, and that would be a written notice, as well as be prepared to answer their questions that they might have about having their information shared through a query retrieve health information exchange, and also include the fact that they can opt out. And if a patient does choose to opt out, then there are certain steps that in the onboarding process we talk about that executes that opt-out, so that at that point, none of that information would flow through the SCHIex query retrieve exchange.
Yes, ma'am.
Second, one question real quick. All of this would fall under TPO for treatment. So, if a doctor's sharing that information for treatment, other than making that part of your HIPAA consent on your form, you just got to make them aware. It would fall under treatment, correct? I mean, if you're sharing that information back and forth between other providers, it'd be under HIPAA's TPO. But my question specifically is, as SCHIex is a state, South Carolina state, like all providers would connect to SCHIex. It's the central middleman. Then does each provider close to Georgia have to join Georgia's exchange, or does Georgia just, we wait on you to connect to Georgia, and then we work with y'all? You see how crazy this could get? I'm just curious.
Well, it could get crazy, and of course my answer is I would connect through SCHIex. But the way that it works, and I can give the example of eHealth Exchange, because there is a big, long policy document and agreement that SCHIex Governance Committee has executed to be a member of eHealth Exchange called the DIRSA. And what we do with that DIRSA, rather than ask all of the participant members to also sign that DIRSA, is we harmonize those policies with the SCHIex legal agreements and policies, pass those down, so that we're making sure with legal counsel and all the resources that SCHIex has, that we're in line with those policies, and so that if we're all complying to the SCHIex policy manual, then by definition we're also complying with any other partners that SCHIex is working with to further health information exchange, which may later extend beyond eHealth Exchange. I mean, the goal of SCHIex is to make data move, and opportunities to do that.
Right. Any other questions? Good question, Joe.
There's
How we
one
doing
o-
on time?
There's
I'm
one
sorry.
over there.
Go ahead.
Is it only the most recent visit, or is there past history visits that you would be able to see? If so, if it's only the most recent, what happens to the old, if we own the data repository, is that information off, or is it historical?
Right. So the first part of the question is related to its ability. Ask the first part of the question again so I can answer that in a second.
Only the most recent visit after.
Right. And so when a patient begins with participation at a healthcare facility who is boarded and certified to be on SCHIex, then CCD documents began to be created. If the patient opts out, well, then those CCDs remain at your repository and stay there. They still get created because that's part of your process. Because at some point in time, the patient can come back and go, oh, I made a mistake, my bad, because you know that'll happen, right? And they'll, no, I want to exchange now because now I had an accident and grief, well, I want them to, have that information. So a lot of times, just by fear of what all this is, a patient may opt out. But once a participant is in SCHIex and is boarded, those CCDs are available at that location, and that patient, now all of that is there. Now the patient goes and presents somewhere else. Well, they're automatically, if that is also an entity that is boarded, automatically they're informed. And if they don't opt out, well then now those CCDs become available. So the history is there once the process starts by the healthcare entity. That's the first part. Okay, the second part?
I was just saying, if it was historical, and you had archiving parameters or purge parameters in your facility after 10 years, you go through this data, is that something you can control if it is your repository?
Right. Yeah, it's your repository and you control it. And when the patient opts out, then the SCHIex has control over the opt-out. And so it won't pull and query. So you don't have to handle that part of the data unless you want it to. But if you went in there to where the repository is and just deleted them, they wouldn't exist anymore. Okay, you have a question.
What is your time frame? What is the time frame for SCHIex? For records to be readily available. What is the time frame?
Yeah, the question is,
Time frame?
what is the time frame for documents to readily be available? They as soon as your healthcare entity boards and is certified with SCHIex, then your documents are available. That's how soon that happens.
But they don't get purged later on down the line, maybe 10 years from now? Don't, okay.
They do not. The CCD document, as you know, is a very small footprint. There's not a lot that goes in with that. So if you have a repository and you decide, okay, I'm going to put a server over here and we're going to have, a terabyte worth of data, you'll never use that up 10 years because it's just text information.
And there's also two types of document. We're showing encounter level documents today, but there are also patient level documents that kind of accumulate over time. And there's a capability in the IHE platform that we use where you can have something called document replace. So in that way, you may just be keeping the most current cumulative longitudinal history of a patient.
More like images.
It could be a CCD that just stays updated. Each different EHR does it a little differently. Some can create them on demand, some store them. So until you kind of get into the weeds a little bit, that is where you can kind of determine how that might work for you.
If you're uploading images and that your data repository.
Right, if you're doing images, then yeah, that's a whole different story. And so each location, I guess the best way to say it is each entity within, just like you do with every other document you create, would follow your local archiving rules, and you would go from there, how much you want to make available to SCHIex.
So we don't have to meet yours, as long as we have something in place at our facility.
Correct.
5 years, we get rid of these images, we would be able to.
Or you archive those, correct, because then the patient would come back to you and do a standard medical records request to get them. But it's remember y'all, it's your data, it's your repository, nobody else controls it or owns it except for you. Okay, let's very quickly, Lathan, I know we're running a little bit behind, but
We'll catch up. And please, I know you had a question. Let me get her question and then you go into
all
the
right,
scenario.
go ahead.
I feel pretty anyway. How would I know as either a provider office or an emergency department that this patient that's presenting to me is in SCHIex, information data is available? How would I know to look or to ask or to retrieve information?
Right.
That
That's a great
that would
question.
be a lot of time for a provider to take time out to look and say, oh, no,
Right.
they're not there.
That's correct. So as you remember, and that's a great question, thank you for asking, because that gets us back down to the basic. Well, how do I know that they're participating? If you are an organization that's now certified on SCHIex, and and you're boarded, and you're in production, you have a production certificate to participate in the network. Well, then as soon as the patient presents and the same patient has been informed and they haven't opted out, all of those elements have met, well, now it's as easy as the link that's in the patient's chart. And the provider brings it up, or whoever's responsible at your organization, they click the link, and then they can see if there's any documents out there from any other participating boarded healthcare entities.
The link is added into my system.
Correct. It's integrated into your EHR, and that's how your EHR gets boarded technically in order to allow the provider to quickly find those documents.
I think Sue, as practical experience.
Sue can tell you. Yes.
Yeah, I do want to share, I think that is a fabulous question because it points to one of the #1 things that providers may be concerned about as a barrier. And in the old days when we were, you know, I compare the origin, the pilots, to riding a tricycle, and this is a 750 Norton that you can take on the road. That's how I compare it. And in the old days, you had to log on, put in a password, and truly, what Les said is it's so different because you open your record and it's part of your record. There is no time lag whatsoever to look and see if that patient is in SCHIex.
And what you saw is real deal. What you saw on the videos today is how it works. Okay? Good questions. All right, let's quickly go through the next phase of what SCHIex has to offer. If you don't want to be, or you are not able to be, like if you don't have an EHR system or you're not able to get boarded yet to SCHIex, you have an option. The option is called Clinical Viewer. Clinical Viewer is a very powerful tool, and the state is going to hear a whole lot more about it, right, David, in the future. But for now, what we want to demonstrate to you is how Clinical Viewer can be like a patient portal. I guess that's the best way to look at it. And you log into the portal, and you're able to see all of the documents that are available out there from participating healthcare entities for that patient. All right? And so this scenario shows that we have a patient that's going to be visiting a mental health center. So we're going to see the Department of Mental Health's EHR. Anybody here from the Department of Mental Health? Okay? So you're going to see that. And that's the example that we're going to give today. Patient presents following a PCP referral. So that immediately means the mental health is going to go out and see if there's a referral out there in SCHIex from a PCP. Behavioral health provider reviews the medical summary, and then they follow through with a diagnosis with the immunization, and they'll see the immunization document as well, and then the following visit to behavioral health. So let's take a look now at this scenario. Again, this is different. This is not SCHIex Exchange. This is the ability for the Department of Mental Health to create a link within their EHR that allows them to link out to the Clinical Viewer portal to see this patient's information. Okay? Okay. So there's the Department of Mental Health electronic medical record, and you see this SCHIex summary. So they brought the patient's chart up, and they're going to click right there for the summary. And it takes them out to the secure portal for SCHIex. There it is, Clinical Viewer, and there's the patient, 62-year-old male. And now they're going to click on Reports. And View Reports, you can have that viewed in different ways. And now you'll see the documents that are available. You've got a BMI chart. This is locally here with the Department of Mental Health. And then you have these documents that are available out there on SCHIex. And then there's the CCD that they bring up. Okay? So they're going to review this CCD document, and they'll go through the problem list and the diagnosis, and you know, the provider's going to be very thorough about what took place at the PCP office and why it was referred to them, and all of that is built in. And let's see, they're going up here. Oh, here we are. Down here looking at the allergy now. Okay? Medications, history of encounters, it's a very thorough document. It has all of the information that you're looking for. Vital signs. And now they're going to go back out to SCHIex again and click on the immunization history. Again, here's that document that shows the vaccines that the patient has received over the course of time. And now here's the encounter summary that they're going to click on. And again, there's a third document from Little River Medical Center. Shows a PCP visit, shows lab test. I mean, everything is comprehensive. Of course, from the CCD, those little links at the top, you click on them and it takes you right to that section, so you don't have to search too far for a patient's CCD that's very lengthy or long in information. Okay, so now they've got enough information that they need, and they have now created, the provider at the South Carolina Department of Mental Health has created their note, encounter note right here, and they've put in the different areas that they're required to do. Does that look familiar? All right. Did they do it right? Okay. If not, I'll make them go back and fix it, because I have control over their mouse. All right? So now you're coming down to the plan summary here, just verifying that all the information is correct. So at this point, now again, remember, they're not in SCHIex Exchange, so there's no saving of the document and it immediately go to a repository and then it be available to be queried and pulled. It's being saved at the Department of Mental Health, and then it's made itself available through the clinical viewer, okay, through the portal. Now we're going into the next section, which is direct, which means what we're going to do is send what you would look at being just a regular email, okay? So they're going to create an email, and they want to send this document back to the PCP so that they can see what the resulting of the referral was. And so here's the clinical summary for SCHIex. That's the subject. They're sending it out to PCP test at direct. That's their address. Everybody, if you get signed up on direct, then you get kind of email address like this.
Can you only, you only send people who have a direct email address from this window?
That's correct.
It would be, it's a closed network.
Correct.
So you would have to be a part of a direct.
You would have to be a part, right. That's the whole idea of it being secure. You would have to be a part of that network in order to be able to receive these secure messages. So now what the user is doing is logging in as though they were at that other location. And they're logging into the portal now to see if they have any messages. Good question. We have to remember our password.
They had to look it up in their password keeper on their iPhone.
This is how you roll. And again, they log in and immediately see that they have documents, and then right away, just like an email, but it's secure, encrypted, and within that network. And there's the document. They'll click on the attachment, and then it will allow them to open or save it. They open it up, and voila, there's that document from the Department of Mental Health. Okay? All right. So this is the scenario of what it looks like to be connected to the clinical viewer, which again, I call it like a very fancy patient portal, and then being able to take that information that you retrieved and created, save it in there, send it through direct, and and now you have your ability to exchange as your alternate. Again, if you don't have a certified, ONC certified EHR system, well then this is your alternative that you can go through, or you can use both. There's opportunities for using both and using direct. Some of you may be in the room today and going, man, I sure wish we had encrypted, secure exchange of PHI. Well, this is it. This is how you get it. We can all card all these services, right, Adrian? Right, for one low price. See you in the back of the room. Okay, very quickly. This is what that looks like. So if I wanted to be a part of Direct, I would have an email address that would be associated to me, to my organization, leslie.perkins@skyx.direct.state.sc.us. It's user interface used to access the mailbox. Direct is enabled. EHR, client server email. This is a requirement. You would have to have some kind of client server email like Exchange or group-wise. And then, of course, be able to get on the SCHIex Direct web portal. And then, of course, be able to send a message. How many of us know how to do that? Okay? So, I hope that was comprehensive enough, but yet simple enough for us to understand how the process works of Exchange, Clinical Viewer, and Direct. And with that, the 3 Bs have taken place. So, any questions? Remaining questions?
I'm the walking mic.
Will pharmacies play any part in any of the immunization data? Let's say a patient goes to Walgreens and for influenza and pneumococcal. Those are past every visit.
It's a good question.
Yes, pharmacies can be approved participants in SCHIex, and if there's an EHR that could connect bi-directional exchange, then that would be an option. Or if you just need to see immunization history, the clinical viewer that you just saw would be a way to do that. If you have minute clinics, you know, I could see that the clinical viewer would be a great way to get history, but you know, hopefully the bi-directional, even if you start with one service, you can always move, you know, as your capabilities allow to the full exchange.
Are there any pharmacies that so patient goes and gets the vaccine in Walgreens after the patient gets admitted? It's a patient, I go to Walgreens to get vaccinated, and then I'm admitted. How is that? They're not actually part of the study.
Well, one way is South Carolina is requiring reporting of immunizations. Now that's in a tiered way, so that beginning January 2014, certain groups, and it kind of graduates to where ultimately all providers, you know, regardless of SCHIex or meaningful use, are going to be reporting to the state immunization registry. So assuming everyone's performing and you have access to the immunization registry, either through Retrieve Exchange or the clinical viewer, then you would be able to see the full picture for that patient. So that's kind of a nice complement is that statute or that legislation or statute in South Carolina to help make sure everything gets there. SCHIex is an avenue to help you meet that mandated reporting requirement.
Okay. Anybody else?
We still have a segment for those who want to stay around and ask questions, but we want to have everyone to make their presentations